Good morning. How's everybody doing? Made it here for the early lectures? Okay, so what I want to do is give you some really practical information and also really let you know how easy it is to influence the genes that turn cancer on and off. And so I hope you'll leave here with some really practical things that you can do. So our environment and our genes are always talking to one another. And there's an interaction between what we eat, our lifestyle, our stress hormones, and the genes that affect cancer. And so that's what I'm going to talk about today. And really, what I always say to my patients is, it matters what you eat because your food is talking to your genes. But this also applies to botanical and herbal medicine. So I'm going to give you some foods and some plant chemicals and some herbs that you can use to actually change whether or not you have genes turned on or off. And I think that's the most powerful thing that we can really do in our daily lives. So not only foods, but plant chemicals. So you'll see on the screen, you'll see tomatoes containing lycopene, green tea containing EGCG, kale containing sulforaphanes, and then on the right-hand side you have mushrooms and the herb astragalus on your top right that contain polysaccharides. And these are all very, very powerful chemicals that actually talk to your genes and turn them on and off. So really, what we can say is our food actually is our medicine. And blueberries are filled with pterostilbene, which is a sister plant to resveratrol. Very, very powerful, super antioxidant as well as DNA protector. So this is how I think about the cancer journey. When someone comes into my office, they will be in one of these four places. And each stage of the journey really has its own focus and its own needs. And so it's really important to understand at each stage what you need to be looking at, what you need to be doing. And that's what I talk to my patients about. What I'm going to talk to you about today applies to all phases of the journey. And so really, every time you eat something, you're actually either promoting health or promoting disease. So what we're going to talk about today is really the field of epigenetics. And I was updating myself on some of the research last night, and now there's a new term called nutra-epigenetics, which is really what this lecture is about, is how you use nutrients, foods, and herbs to affect what happens to your genes. So your DNA is like software, basically. And if you open up software, then you can use it. If it remains closed, you can't do a Word document. And the same with your genes. They're sitting there, but they're not fate, they're potential. And whether those genes are turned off or on really depends on what diseases you get, what vulnerabilities you have or not. And so epigenetics is really about how things in the environment of the cell will either keep a gene turned off or turned on. And I'm going to show you two of the biggest pathways that influence that we actually know the most about, and then the foods and herbs that actually turn things on and off. So we're just really talking about gene expression, which means is the gene on or is it off? So methylation is one of the main pathways. And I'll show you a picture of what that looks like in a moment. And that's just a reference for those of you who like science and want to read some more. But this is a picture of coiled DNA. And the blue running through there is actually the DNA. That's actually your genes. The little green dots are what we call methyl groups, and they are little chemical groups that sit on top of your DNA, and they act as on and off switches. And then the red there are histones, which I'll talk about later as well, and they are another chemical group that can either keep a gene turned on or off. And basically, we have things that can affect these methyl groups, can affect the histones, and you'll be surprised at how common the herbs and nutrients are that I'm going to tell you about. So DNA is actually just vulnerable when it's unwinding. So every time a cell divides, then the DNA unwinds. So the first picture was a coiled DNA, and then this is the unwind while a cell's dividing. And so it's sort of like, if you're protecting your heart and your hands are in front of your heart, then not so vulnerable. But if you're like this, then you're vulnerable. And the DNA is the same thing. In this state is when it can be damaged or altered or changed. And so we want to protect DNA. So there are a lot of things that actually, besides food and nutrients and herbs, that affect whether genes get turned off and on. So I think it's important to understand whether you get enough sleep will affect your gene expression, how you manage your stress, whether you relax deeply or not, whether you exercise, your exposure to toxins. So it's not only molecules interacting with your genes, but actually your own behaviors can actually affect the hormones and the neurotransmitters in your body that are surrounding and bathing the tissue of your cells. And so really how we live is the most important factor. And I think it's important to remember that because we can all get caught up in whether or not something in a bottle is going to save us, right? But it's actually how we live that also affects our gene expression. So we want to be mindful of environmental exposures. And I always like to remind people that body care products, personal care products are part of our environmental exposures. So you have to be very aware of what you're putting on your skin as well. Your shampoos, your lotions, your cosmetics, your makeup. All of these things actually get absorbed into the body and can interact with your genes and turn them on and off as well. And women, of course, are putting stuff on their face and lips and skin much more than men and have a lot more stimulus from chemicals from cosmetics. Plastics, I think a lot of people aren't aware that really you should drink your water out of glass. I did not choose this container myself. And that you should not use plastic storage containers. If you can store your food in glass, that's much safer. And especially when sunlight hits a plastic water bottle, it releases some of the chemicals into the water. We ingest that, affects hormone expression. Some canned food, most canned foods actually have plastic lining the can. And there's just a few companies, Amy's is one of them, that doesn't use BPA in the lining of their cans. So it's really everywhere. Credit card receipts are coated in BPA, one of the worst chemicals associated with plastics. So people that handle credit card receipts are getting more exposure. Mother's milk contains BPA. So it's really ubiquitous in the environment. So if we take proactive steps ourselves, we can lower our own exposures. High body fat is also a risk factor. Your stored fat, especially around your abdomen, is actually a storage depot for environmental chemicals. It's a little factory for hormones, and it's also a factory for lots of inflammatory molecules. So by becoming more lean, we actually reduce our risk. People who have a high percentage of body fat have almost 40% higher risk of getting cancer or having a cancer recurrence. If you're diabetic, you have a 50% chance of having cancer over someone who doesn't, and a 50% increase in having a recurrence. So managing your body fat and your blood sugar and your insulin are also what I call environmental factors, meaning the environment of the cell. And so what we really want to think about is what is the soil that our cells are living in the same way that you think about a garden, and we change the soil and we make compost and we build up the nutrients in the soil so that we get healthy plants instead of diseased plants and weeds. In the same way, we want to actually change the environment of our cells so that we change gene expression, so that we change the amount of signaling from insulin or inflammatory molecules or chemicals or hormones that are influencing our cells. What a lot of people don't know also is that grilled food, and you get blackened, charred protein, that is a carcinogenic chemical. You don't want to blacken your food. So if you like grilled food, really lightly, just flip it over really quickly and then let it cook lightly. But the minute you get blackened charcoal for protein, this doesn't apply to like if you grill vegetables or fruits, but grilled protein actually is a carcinogen and is most linked with colon cancer and cancers of the digestive tract, but in fact can turn on other genes as well. So what we really want to do is see how we can take control of genes getting turned on and off. So the major forms of the way we control genes, the things we know the most about research-based are methylation, these little groups that sit on top of your DNA that either silence or give voice to your genes, and also histones. And I'm going to show you all about that. So here is an example. It's just a diagram that shows you, let's see where my pointer is. There we go. So you can either turn off a tumor suppressor gene, or you can turn on a tumor promoter gene. So of course we want to, if you have these histone imbalances, then you're going to actually have the off switches and the on switches reversed, right? You want to be able to suppress tumors. The genes that are oncogenes, you want to be able to suppress those, keep the off switch on those, and then you want the tumor promoter genes to be turned off and the tumor suppressor genes to be turned on. So there's lots of herbs and nutrients that actually do that, and I'll show you what those are for the rest of the lecture. So here are some really, really common foods that actually do this. You know, we always talk about eat your broccoli, eat broccoli sprouts, eat kale, they're full of sulforaphanes, but why is this actually important? One of the reasons that the broccoli family is so important is the sulforaphanes and the isocyanates. These are the phytochemicals, the plant chemicals that are in this plant family. These actually have multiple functions, but one of the important functions is that they actually inhibit histone deacetylase, which is one of the enzymes we want to keep turned off so that we have that protection on our DNA, that we can keep the off switch there. The beauty of the sulforaphanes in all the broccoli and cabbage family also is, like most plant chemicals, they're multitaskers and they do a number of things. And the sulforaphanes not only protect your DNA in this way, but they also act at every stage of cancer development, whether that's the initiation, early stages of cancer developing, the growth phases, or the capacity for a cancer cell to metastasize and travel to another part of your body. And so when we use plant medicine and food medicine, then we actually get these multiplicity of effects. I'm sure most of you have heard about the value of green tea. It's another multitasker, and I'm going to show you a slide of all the things that green tea can do, but in this context, it is one of the chemicals that actually inhibits one of the enzymes, a methyltransferase, so those methyl groups stay where you want them, right? And so these really, really simple foods and nutrients that we all have access to can actually create this environment that is inhospitable to the development, the growth, and the spread of cancer. And so that's really our goal, is to take control and create an environment where cancer cannot arise or thrive or spread. And that's the power of actually using plant medicine and plant foods that have concentrates of these powerful chemicals. So let me show you what they are. In terms of the methyltransferase, of those little methyl groups sitting where you want them, folate in the form of methyl tetrahydrofolate, that's the MTHF, that is your active form of the B vitamin folic acid. Leafy greens. All you have to do is eat lots more leafy greens. Black-eyed peas happen to have a high amount in this part of the country. We don't eat them too much, but certainly if you come from the South, you're familiar with them. Avocados are one of the great cancer superfoods, not only because they affect the methyl groups, but avocados are filled with antioxidants and a great source of glutathione, which is one of your super natural antioxidants that protect cells. People who have genetics where they make plenty of glutathione have less cancer risk than people who don't. Flavones, these are the things that make fruits and vegetables colorful. So that's why we say berries, pomegranates, carrots, kale, blueberries, right? All the things that have a lot of color. Anytime you eat something with a lot of color, you're going to be getting lots and lots of flavones and antioxidants, some of which specifically affect these enzyme groups that protect your DNA. The sulforaphanes I just mentioned, primarily the cabbage family, but a lot of people don't know that maca is a cabbage family root, and it's a adaptogenic tonic herb from South America, one of my absolute favorite medicinals, and it also is rich in sulforaphanes. Butyrate is a byproduct of the digestion and metabolism of fiber. So a high fiber diet produces butyrate in your gut, and that actually gives you cancer protection. That's one of the reasons to eat a high fiber diet. One of the best foods for that is garlic, to increase your butyrate. And the diallyl sulfide in garlic itself will turn off this enzyme. Soy contains flavones called, one of which is genistein, has this impact. A lot of people don't know soy is also an aromatase inhibitor. So if you have a hormone-positive cancer, an estrogen-positive cancer, either breast cancer and also prostate cancer, you can actually turn those off. And you can't talk about cancer without talking about curcumin, the wonderful phytochemical that comes from the root turmeric. And I have a slide in here, I think, that shows that curcumin interacts with over 100 different genes. And if we had a drug that did that and was safe to take every single day without danger, that would be a blockbuster drug. So you can see how powerful plants are in this way. I'm looking at my timer. I only have 9 minutes, so I'm going to speed up here so we get to everything. So boswellia is a very important anti-inflammatory herb, and this plant also will act as a super anti-inflammatory, but it has this impact also on the DNA. You know, I actually think I had a 45-minute lecture, so I'm going to pretend I have more time here. Okay, all right, so you know, coffee is actually a super antioxidant. So for those of you who like coffee, in moderation. However, it's one of the most heavily sprayed crops. And so you must use organic coffee if you're going to do coffee. And I recommend that you do Swiss water decaf because you get less acid in it. And the decaffeination process itself can be laden with chemicals. So the green coffee beans are rich in chlorogenic acid, which also has this effect on tumor suppression, which is really cool. One of my favorite herbs is epimedium. It's a Chinese herb. It also is very protective to the bones. So for menopausal women who are looking to reduce osteoporosis, or if you're on hormone-blocking drugs that increase the loss of bone mass, epimedium is one of the most powerful herbs to use, one of my favorite Chinese herbs. Chrysanthemum flower is another Chinese herb, and it's a lovely beverage tea. Hawthorn berry is found in both Chinese medicine and in Western herbal medicine, and it's anything that's a berry has a rich color. This is a deep red berry, and that tells you, again, that there's powerful flavones and antioxidants and gene-altering chemicals in the plant. And Artemisia is mugwort. Many of you may know the plant mugwort. And this actually is an extraordinarily powerful anti-cancer herb, not only because it alters gene expression, but because it also binds to iron, and it will enter the cell and act like a little bomb to create oxidative stress. And so I'll give Artemisia to patients who have high iron levels, and that will allow us to utilize this property of Artemisia to actually affect the cancer cells. Selenium is also a micronutrient, a micromineral, that most people know it as protective to the cardiovascular system, but it has a lot of anti-cancer effects as well. And if you eat 2 Brazil nuts a day, you can get your full dose of selenium, so you don't actually have to take a pill, and in a nice organic form. A therapeutic dose of selenium might be 400 micrograms a day, so that'd be 4 Brazil nuts. And on that note, let me just say that I think it's really important to understand that there's a difference between a nutritional dose of something and a therapeutic dose of something. And so that's where you often need the guidance of a healthcare professional so that you get in that therapeutic dose range if you have a serious illness, right? So I'll give you some doses as we go through this. This is, you're going to kind of see the same list. I'm trying to emphasize the same foods and supplements for you so you can see that it's simple to do and you can use a few things and get a lot of effects. So on this list we see, again, leafy greens. We see green tea. We see soy again. Remember, almost all the soy in the United States is genetically modified, so if you're going to use any soy product at all, you want to make certain that it's not genetically modified. Quercetin is one of the most powerful anti-tumor chemicals, has a big impact on DNA. It's also a super antioxidant. And quercetin is found in red and purple pigments in nature. So the red onions, for example, or the red skin of an apple are very rich in quercetin. And of course, you can take all these things as supplements. So if you're going to try to build a diet that has all these anti-cancer chemicals in it, then you'll choose from these foods and herbs. And then if you actually have a disease to treat, then you'll want to take pharmacologic doses, therapeutic doses of these chemicals. And you need guidance to do that. Again, you'll see curcumin interacts with so many genes. We also see it here in terms of gene transcription, which means does the software get read and send out a signal to build a protein? And is that protein going to turn cancer on or off? And so these are plants that actually control that. Resveratrol, I think many of you know about. Again, it's one of those plant chemicals that interacts with over 50 genes and is safe to use long term. I think it's most well known as, again, a cardiovascular protectant, but it's one of the only plant chemicals that has been shown to actually protect the DNA and increase longevity. And we actually have data for that. I also was just at a seminar with a researcher who studies stress in women, and she's presenting a paper showing that meditation also protects your DNA. So I like that. And anything really, really dark purple or red is going to have resveratrol in it. Most people think about red and purple grapes, grape juice, red wine, but actually cranberries and blueberries have a little bit in it too. So it's not only in a few plants. When we make supplements, we use a plant called Polygonum cuspidatum, which is actually a Chinese herb. And so sometimes what I'll do is I'll take the whole herb extract to get all of the phytochemicals in a plant, and then I'll put resveratrol powder in it to get that therapeutic dose of the resveratrol. And then we're getting all of the plant chemicals that nature gave us, along with one that we know really moves the needle. And whole plant medicine, I think, is important. Whole foods are important because we don't know enough to know exactly which phytochemical or which combination are the real pearls. We isolate things in the way drug research is done, but if we use the whole plant along with the plant isolate in a concentrated dose, I think that's the best way to really get a good effect. And that's your reference there. So here's a diagram showing you that resveratrol acts both with tumor suppressor genes and also tumor promoter genes. So we got on switches and off switches in one phytochemical. Turmeric is a really amazing plant. It's in the ginger family. It's a subtropical. It's a very beautiful plant. And here's a diagram showing you a number of genes that turmeric interacts with. So when we say these plants interact with your DNA, we're not talking about one gene, right? We know resveratrol interacts with 50 genes. We know turmeric interacts with over 100 genes. This is a diagram with the genes we know turmeric interacts with. And this is why it's powerful to choose these plant chemicals. Green tea also has this multiplicity of effects. And I want to just go through some of the things you might not know that green tea does. It actually helps balance your blood sugar and your insulin. And I mentioned earlier that diabetes, prediabetes, high blood sugar, high insulin is one of the biggest risk factors for cancer. So here's an herb that alters DNA, alters blood sugar and insulin. Also, the HER2-neu type of breast cancer, the drugs below here, Herceptin, Tykerb, and Perjeta, the EGCG in green tea actually enhances and is synergistic with the action of those drugs. And so a lot of oncologists will say you can't take herbs and chemo together, you can't use herbs and antioxidants with radiotherapy, et cetera. But if you have someone that understands drug-herb interactions, drug-nutrient interactions, whether or not a botanical or a food would enhance the activity of chemotherapy or radiotherapy, you can actually get these synergistic effects. And this afternoon, I'm going to actually do a lecture on side effects management, and I'll talk a lot more about that. Green tea actually is a super anti-inflammatory too. It will actually turn off some of the pro-inflammatory molecules, the production of those, and also by doing that, it will turn off some of the growth factors that promote the advance of tumor cells. When a tumor builds its own blood supply, it grows exponentially and then can also travel and metastasize. So green tea is one of our big tools to inhibit that process. And I mentioned also earlier that soy was an aromatase inhibitor. Also, green tea is an aromatase inhibitor. So we have, nature provides us with these wonderful chemicals. Aromatase inhibitors are given to women who have estrogen-positive breast cancer to stop the production of estrogen in the tissue. And so we have drugs that do that, but we also have botanicals and phytochemicals that do that. The two most powerful are the soy and the resveratrol, and then I put green tea next in line in terms of its power to alter estrogen metabolism. Bone remodeling, again, when we are looking at, cancer is a disease of older people for the most part, and both men and women will lose bone mass, and so we want to be interested in how to preserve that. And resveratrol is one of the most powerful things that I use to protect the bone. Epimedium, I mentioned earlier, and then also green tea. So if I make a formula, an herbal formula for someone for protecting the bone, preventing osteoporosis, then I'll put these herbs in there as well. So I want to summarize. Oh, now it says I have 26 minutes. So I am going to summarize slowly and let you guys ask questions. Okay. How about that? I did that. All right, so I want to emphasize that plants are multitaskers. The chemicals that are in plants, the phytochemicals, interact and bind to lots of different receptors, lots of different genes, and can turn genes on and off. That is the core message that I have for you. And I've given you a handful of things that do that really powerfully. And ultimately, what we want to do is be at peace when we make our choices about how we're going to manage our health so that we're not worried about getting cancer or getting a recurrence in the first place. And so this toolbox in which we use plants and from our diet and medicinal plants to actually control gene expression is a way to have a sense of control of our own lives. I think that cancer and oncology and the relationship in the medical setting is incredibly disempowering and disenfranchising to cancer patients. And one of the most important things is to feel like you have a sense of control of what's happening to you, your body, and your life. A lot of times when people come into my office, the first thing I say is, you don't have to start your chemotherapy next week. You don't have to have your surgery next week. You can take a breath. You can get second and third opinions. You can make sure that this decision is your own. You can get your kids handled. You can get your work handled before you jump into something that's stressful and traumatic. And so I think it's very important to understand that a cancer diagnosis is not an emergency. You don't have to start tomorrow. But oncologists will make you feel as if you don't start next week, it's going to cause you to die. And that's an unfair way to speak to cancer patients. My basic model is a team approach, and I always say the loudest voice on that team should be the patient's voice. And when you have a complex illness, you want to have a team because you need a disease expert. You might need what the oncologist knows. But you also need a health expert, and it's my feeling that health should be the goal, not a war on cancer, but actually from the day of diagnosis, we should be planning for your health. And so that is what patients want. Patients aren't interested in the disease. They're interested in having their health back, getting their life back, going forward. And so there has to be a voice for that on the team. And what I've tried to do over the last 35 years is actually partner with oncologists and radiologists and surgeons so that they get that. And I actually have been able to do that. And I encourage all of you to ask your physicians to participate in a team approach and to consider that health is your goal. The other thing that I think is really important to understand is that we're coming into an era of rationed healthcare, which means that oncologists are going to be paid probably by the diagnosis and will have a finite amount of time to be talking to you as the patient. And then you'll get handed back to your primary care provider, or you'll go seek out more enlightened healthcare providers, acupuncturists, naturopaths, chiropractors, nutritionists, et cetera. And these are the people who are going to be your long-term team, whether you're interested in prevention, say of a family that gets cancer. You don't want to be one of those people. That was my story. Both of my parents have had more than one episode of cancer each. And so early on, I decided I wanted to keep my genes turned off. So I went on this journey to find out what would do that. And so I have a book that's out on the table outside, which people are going, is it for sale? No, it's a gift. Go take one. It's a gift for you. And it also, my pleasure. This is my mission. It's my mission. And also, I have a guide for those of you for whom this is all brand new. You're not sure how to eat. You're not sure how to go shopping. You're not sure how to make a healthy shake, etc. Then I just have a guide that all the questions I get asked in the first few visits in my office, the answers are in that guide. And I also have a whole bunch of gifts for all of you, some reports and lists and recipes and things for those of you who would like to have more information. And so I'm into giving gifts so that you get going and actually engage and actually do everything. So because I have some more time, I can take some questions. And I think I'll put back up one of the slides. I was talking as if I had 30 minutes, and I just ran through it. So I want to show you that list again of the most important plants. And then who has questions? I'll be happy to take questions. Yes?
I read that if you have a thyroid issue, not cancer, but thyroid, then you should be eating too much of the cruciferous family because of the... Can you talk more about that?
Yes. The question is, are cabbage family vegetables contraindicated for people with thyroid issues, or do the cabbage family vegetables actually create thyroid problems? In my experience, there's a very small population of people for whom that is an issue, and it's a very small number of people, and most of those people actually know that if they eat cabbage family vegetables, they feel tired or they feel bloated. A healthcare provider can help you sort that out. But it is not my opinion that the cabbage family vegetable causes thyroid disease.
So like let's say if you steam the vegetable or if you ferment it, would it help reduce the, I don't know the word for it.
So if we don't eat the raw food, but if we process it in some way, either by fermenting it, say making kimchi, like a fermented cabbage product, or if we cook the vegetable, does that change it? Actually, it's a really smart question because there's been some research done that shows that we actually get more of the sulforaphanes out of the cabbage family vegetables if we don't eat them raw. And there's a big, fashion of the day that raw food is better, but it's actually easier to digest cooked food. And in fact, when people are going through chemotherapy, I recommend you eat mostly cooked food because chemo is really hard on your digestive tract. And so you want to have food that's easy to digest, easy to get the nutrition out of. If you're immune suppressed, you want to cook your food so you're not eating so many bacteria, right? So you have to do what's appropriate to you. I think a combination of raw food and cooked food is a normal diet, basically. And so I'm middle path, You have to know everyone you listen to, you have to know what their bias is. Well, I'm pretty conservative, I'm very pragmatic, and I'm pretty middle path. Extreme diets and extreme therapies are for small numbers of people, and most of us need something that's in the middle, I think. Other questions? Yes?
You're doing a workshop at noon in the workshop room?
I'm doing a workshop in the room next door at 12:30, and it's actually on the management of side effects. It was printed incorrectly in the program, but I'm going to go through the most common side effects of cancer treatments and tell you how to manage those and protect your healthy tissue and your healthy cells.
And it's 12:30 because it says 12 here.
Oh, it does?
12:30?
As my understanding it is, but I'll be there at 12 if the program says 12. I just follow directions. Yes?
Doctor, before you spoke of getting your genes checked,
Mm-hmm.
eat for your genes.
Yes.
Are you familiar with that?
Yes, yes. So the question is, what about looking at our genetics to figure out what the toolbox is for us, whether that's foods or herbs? And there are some tests now, they're called genomic tests. That's different than genetic tests. So what I use are the genomic tests, which is one step out from your DNA. DNA, again, like software, it maps for the production of proteins. And those proteins determine how the cellular machinery runs. And so you can often see what you can and cannot metabolize. You can see if you don't handle certain chemicals in the environment well. You can see if you tend to produce more inflammation than somebody else, if you tend to produce more blood clotting. I think that the tests that I'm familiar with in terms of diet, like what food to eat, I think that's a pretty simplistic model, and that, like, most of us are mutts, you know, especially in America. We don't come from one pure genetic line, you know. We're not pure breeds. We're all, you know, mixed up. And so I think that's a pretty simplistic model. It can be useful in context, but by itself I don't think it's enough information to make all the decisions we have to make. You know, but what's interesting about doing genomic testing is you only have to do it once. It is expensive, but you only have to do it one time because your software is your software, right? But what's more important, what this lecture was about, is whether you turn those genes on or off. So my story is that both of my parents have had more than one episode of cancer each. Half my family gets diabetes. The other, both sides get cardiovascular disease, strokes, heart attacks, high cholesterol. One side of my family, everybody goes blind from macular degeneration. So that's my pedigree, okay? So I wanted to keep those genes turned off. So I've been my own study of an N of 1, right? I don't have any evidence of any of those diseases. So I got interested in this kind of medicine, in plant medicine and eating healthy, and the power of lifestyle and diet and herbal medicine to transform gene expression. I was a cell biologist, so I love this stuff. And so I don't have any evidence of the diseases that run in my family. I'm in my 60s. So I have done it, right? So far, so good. And so that's really my message to you, is you can. And even if a gene has been turned on, you can actually turn genes off. Harder to do. Harder to do, right? Especially if damage has been done. Yes?
Do you have any more books? There's no books out there.
I brought several hundred books, and if they're gone, they're gone. And you can get them on Amazon, but they won't be a gift then. If you go, the link on this slide takes you to a website called 32waysbook.com. And if you go through that portal, you also get a bunch of gifts from me from there too. I'm like the gift-giving genie, you know. Yeah, so if you go to that website, you can buy the book through Amazon, but you'll also get a bunch of free stuff from me. Yes?
With the, everybody talks about the, the BRCA gene and BRCA and all that.
Yes, what about?
If they're mutated, is it possible to bring it back with HGen?
So this is a question about the BRCA genes. What we hear about most in the news is BRCA1 and BRCA2, which are only 5% of all breast cancers. However, BRCA genes are also associated with lung cancer, colon cancer, pancreatic cancer. BRCA genes are errors in DNA repair. And so if you have that error, I don't know that it's possible to turn the BRCA gene off once it's on. That's a tough one. But you have to remember, it gets a lot of press, but it is only 5% of all breast cancers. But because Angelina Jolie had it, then everybody thinks they should get double mastectomies. You know, the answer to your question is really, I don't know. That's really the answer, because if we can say we know that there are ways to turn genes off and on, then there must be a way to do that too, right? And we also know that people that carry the BRCA gene don't all develop cancer. However, 95% of people who carry the BRCA gene typically do get cancer. And so it's an aggressive gene. One thing to understand, if you or a family member carries BRCA, you're very vulnerable to radiation because radiation damages DNA, and if you can't repair your DNA very well, then those women should be having mammograms. You should limit your X-ray exposures, right? If you have that kind of a DNA repair issue, then you should opt for MRIs, which don't expose you to radiation, or ultrasounds as diagnostic procedures. Yes?
I have a question regarding mammograms.
Yes.
I had breast cancer, and 2 years ago I stopped the mammograms. I'm doing sonogram, and they won't do an MRI because I'm not doing the mammogram because of insurance.
Okay, so the question is, I had breast cancer, I don't want to do mammograms, my insurance won't pay for MRIs. Is that it?
Yeah.
So you can actually, there are discount portals online where you can get discounted MRIs. You can pay by cash for MRIs, and you can just go to a radiology center and say, my insurance company will not pay, and instead of $1,000, you can get it for $300. So if that's what you want, you can ask for a cash price. Yeah.
So what are your thoughts about frozen, fresh would be great, but frozen food and dried food? Do you have any guidelines?
What are my opinions about fresh, frozen, dried food? So the best thing is to eat fresh food, right? Absolutely the best, but we don't all have those choices. It's interesting. I was talking to someone at Whole Foods, this is not a plug for Whole Foods, who told me that it's healthier to eat fish that's flash frozen on the ship than to eat the fish that's in the case because it just doesn't have as much bacteria growing in it, right? So it depends what we're talking about, right? But fresh food's always going to have more nutrition in it. Similarly, if you overcook your food, even if you started out fresh, it's not going to be full of nutrition. So how we store food, whether or not it's grown close to where we live and it's picked ripe or it was shipped for a long time, all these things matter. The most important thing, I think, is to eat organic, chemical-free food, fresh as possible, because organic food is grown in soil that's more rich, so we're getting more micronutrients because the soil is providing those. A lot of our food today doesn't actually contain the micronutrients we think are in it because the soil is so deficient. So ideally, what is that? Turn it off. Thank you. So ideally, we eat food that's organic, that's grown close to where we live, hasn't been shipped, hasn't been stored, hasn't been picked green. Ideally, right? Ideally. Certain things are stable in food. So protein's pretty stable, minerals are pretty stable, but vitamins and enzymes, you lose those. You really lose those. And oily foods, fatty foods can become rancid very quickly. So if you have nuts and seeds and things, you should store them in the refrigerator so that they don't oxidize as quickly and don't go as rancid as quickly. So how we store food and prepare it and ship it, et cetera, all these things impact the nutritional value. I live in California, so we can eat everything fresh all the time, but not everybody can do that. Yes?
You know how you hear so many bad things about soy, even like organic, and so it should be fermented, and what's
Okay.
your take on that?
So what's my take on soy? I'm not anti-soy. Certainly, we don't want to have genetically modified soy, but I think soy is one of the great foods on the planet, actually. It feeds a huge number of people in Asia quite well. They actually have lower rates of most hormonal cancers in countries where soy is the primary food. There are studies that show women who have soy in their diet as teenagers have less estrogenic cancers later in life. So again, some people don't digest the phytic acid in soy. And so those people, it's not a great food. But most people do. And the traditional soy foods are processed in a way that make them more digestible. But basically, my point of view is that there's not one diet for everybody. And you have to eat what you can digest. You have to eat what you can get nutrition out of and what doesn't throw you off. We're in an era where our food's so engineered. There's lots of proteins in food that trigger inflammation. Our gut flora isn't normal, so we don't actually have the capacity to digest everything we eat anymore. So I think this is a very individual question, but I think it's dangerous to get into some extreme dogmatic view that says everybody should eliminate this food. If you look at human beings eat all kinds of diets all over the planet, there's a lot of ways to eat and be healthy. The question is, what's right for you? I think that's the better question. I'm going to let someone else ask a question. Yes?
Is it possible to take too many supplements?
You know, I'm the wrong person to ask for that because you should see what I take. And I don't have any illnesses. So I think it depends what your goals are for yourself. I think it depends on the quality of supplements, on your digestive tract. I am a high potency prescriber. And when I have cancer patients, some of them take 30 pills 3 times a day. I try to make that into powders and liquids and things like that. But if we want to get a pharmacologic effect out of nutrients and herbs, there's no way around it. You're going to have a handful of pills. Should you do that every day of your life? Not necessary. It depends what your goals are. I'm really into taking lots of herbs and nutrients, and so far my little experiment's going pretty well. But it depends. It's expensive, right? It's really expensive. So if I have a patient that doesn't have a lot of money, I try to put the very most important things, like the list of stuff I gave you in the lecture here. Make sure you got those things, right? Make sure you have those. Then if you want to, have do something for brain aging and take every single herb that's anti-cancer or whatever, you do what I do. I'll also tell you, on my blog, I have a blog post called A Better Breakfast, in which I give a base recipe for a smoothie, because I'm a big fan of having a good way to get enough protein every day. And so I put the basic recipe, and underneath it, I have what I put in my smoothie. And so if you want to get some perspective of what's possible, I put Chinese herbs and all kinds of nutrients, all kinds of things are in my smoothie. So I think it depends on each person's individual goals. I'm very respectful of what people want for themselves and what you're willing to do, what you can afford. You have to have a plan you can do long term, I think. If you really want to have stable health, you have to have a plan for the long term. And it has to work for you. And I think it also depends. There's a lot of ways to be healthy. Can you eat a raw food diet and be healthy? Yes. Can you be a vegan and be healthy? Yes. Can you eat meat in your diet and be healthy? Yes. But you have to be thoughtful about it and have a plan that makes sense for you and your genetics also. Certainly, research tells us that plant-based diets are healthier diets. Absolutely. That doesn't mean you can't also eat some animal products, but your diet really should be mostly plant-based if you're going to have health, because we need all those phytochemicals. We need them because they talk to our genes. And that's really what this talk was about. Yes?
Is there any major difference between turmeric and curcumin besides the concentration?
Is there a difference between turmeric and curcumin? So that's the question about what's in a whole plant versus what's in an isolate. So certainly a whole plant is going to be a complex mix of many, many chemicals. And because we don't have the money to really study herbs the way we all want to, we don't even know everything that's in all of our medicinal plants. So then the plant isolates, which would be like curcumin or sulforaphane or resveratrol, are just that. They're single molecules. And I'm a great believer in the design of nature having wisdom in it. So although I like to use the isolates in pharmacologic doses to get a big response, I also use the whole plant as well, because we don't know enough to know what we're missing when we just use the isolate. And if we're just using the isolate, then we're in allopathic medicine, then we're just thinking we have a silver bullet for something. Whereas there's all kinds of micronutrients and small amounts of phytochemicals that we have yet to understand, or the synergy that's in a plant. So my strategy, and this is, there are a number of people who do botanic medicine that choose to use our modern ability to isolate chemicals we know are big levers, but not to forget our tradition that the whole plant actually has its own unique gift to give us. So you can certainly add turmeric to your diet and be getting some curcumin in it. You won't be getting a therapeutic dose of curcumin, however. So that's what's important to understand, right? Yes?
A question about spinach, about eating it raw, sauteed. Is it going back again to what our body can digest? Because somebody has been told that it's better to saute your spinach.
So what about spinach? Should we eat it raw or cook it? Some foods are easier to digest if they're lightly cooked, right? We don't want to destroy nutrients. And again, when you're younger, you have more digestive fire than when you're older. So again, you have to look at what you can digest yourself. But the spinach, chard, and the cabbage family, lightly steaming, actually makes the therapeutic value and the nutritious value of those foods a little more accessible to your digestive tract. Did that answer your question?
I think so.
Okay, yes.
I have two questions. One is, if you're focusing on the raw foods and the greens, what is your perspective about getting too many oxalates in the greens and that becoming a problem? And the other is, do you recommend as you get older digestive enzymes?
Two questions. One, what about oxalates in certain greens? Can you get too many? Is that a problem? And what's my opinion on digestive enzymes? Is that correct?
Right.
Okay. All right. So here's my take on, people go, oh, can you eat too much soy? Will it cause problems? Can you eat too much spinach? Can you eat too much chard? If you have family history or personal history of making kidney stones, you better be on a diet that eliminates plant chemicals that are problematic to you. But the truth is, most people could never eat enough spinach or chard who don't have those problems to get there, right? There's a small population of people who have to be careful about oxalates, right? If you're one of them, be careful, okay? Limit that. But otherwise, it's sort of how doctors think that certain foods are like drugs, but it's just too hard to eat that much. Your digestive tract would rebel before you could eat that much, right? So your digestive tract will limit how much you can get. If you're eating whole foods, you're not eating oxalates, you're eating whole foods, right? And so those foods have a lot of fiber. You're going to get full pretty fast, right? So there's a small number of people who have trouble with oxalates. Those people should limit those vegetables. But do we all need to? I don't think so. Digestive enzymes. That's a kind of a catch-22. We have so many things that actually damage our digestive capacities that some people actually do need digestive enzymes. My preference is to use herbal medicines, like bitters, to stimulate normal digestion. But it is true, as we age, our hydrochloric acid in our food does go down. Now so many people are on like proton pump inhibitors, drugs like Nexium, or taking antacids all the time. So when you don't have hydrochloric acid in your stomach, you can't sterilize your food. And then you're ingesting all this bacteria. You also can't digest your protein normally. So all kinds of problems occur when we mess with our normal ecology of every section of our digestive tract. The stomach's supposed to be acidic. And so if we take a drug that destroys that, then all kinds of other problems happen in the rest of the digestive tract. So again, my answer is always, what's right for an individual? I don't have big standardized things that I do with every single patient in that way. My practice is extraordinarily individualized. So I look at each individual. I might even test if someone is making enough lipase or amylase from their pancreas and see what's going on. Really quite an individual thing. But my first approach is to try and restore normal function, not take something in a bottle to replace it. And so, but you have to see if that's possible, right? If it's possible, great. That's the better solution, is to restore function. But if we can't restore function, we still want to have good digestion, so we get nutrition out of everything that we eat, right? So my answer is always who is it we're talking about? What do they need? There's nothing wrong with digestive enzymes, and certainly in cancer care, we use high doses of proteolytic enzymes, the proteases. Famous German formula Wobenzyme is all proteolytic enzymes and rutin, and that has a big impact on the cancer ecology. So it really depends who we're talking about. High levels of proteases are therapeutic in terms of inflammatory diseases. So is it a good tool for the job? How much do you need for how long? That's a better question, I think. But restoring normal, healthy function is always the first priority. If you can do that, do that. Right. Yes?
Any thoughts on pasteurization or positive, negative?
Any thoughts on pasteurization? I'm not super knowledgeable about it. There's always the continuum of I don't like to tamper with nature, but there are public health issues to consider also. So again, it depends. If you have your own cow or goat, don't pasteurize it. If you're going to ship that, if you're going to ship it somewhere and it might grow bacteria, it might be dangerous to the general public, Again, I'm not a black and white thinker, I never have an answer like everybody should do this, everybody should do that. What's the context that we're talking about? So I have a feeling my time is really up now. So thank you for your attention. And